I've done a video series on my facelift technique, as well as deep plane facelifts, as well as deep neck lifts, and how I do what I do. This video is going to be talking about what things don't work in the neck. And unfortunately, I know if you've got like a little waddle underneath the neck, oftentimes my patients come in and they want to just do something as minimally invasive as possible. They want a thread lift, they want a little liposuction, they want a little Kybella in the neck. And I'm going to talk to you about what causes a neck failure. And I'm specifically talking not in this case about someone per se with platysmal bands that really needs a facelift. I'm talking usually about the younger patient who comes in that is just having, like, if you look at me, I'm in my mid-50s, but because I'm Asian, I don't really have any visible banding, but I've got a little neck fullness. And this is a great looking at this saying, hey, you know, I think a little Thermage or a little bit of Ulthera or a little bit of RF microneedle or a little Kybella would just do the trick. And I would really, really tell you, please do not do those treatments. They are not going to help and they're going to create problems. So if you want to hear really in depth in my video where I talk about the deep neck lift, why those are areas of failures, please listen to it, because the solution for a neck waddle, I'm not talking about someone with banding per se, is going to be a reduction of the deep neck space, not the superficial neck space. So I want you to understand, if you're having this issue and either can't afford either downtime or the procedure with the deep neck lift, why not to do Kybella, Thermage, Ulthera, RF microneedle to manage the situation. So right now I'm specifically limiting my discourse and discussion to a full neck. I'm not talking about a sagging neck in terms of band exposure. I'm talking about a full neck underneath the chin. Again, I hate to say, it's sort of like me. If you look at me like this, you can see that fullness there. This is not a good option to do Kybella or to do Thermage or anything. So, or a thread lift. They're not going to fix the situation. So let's sort of understand the compartments of the neck. The platysma muscle, when you look at someone sagging, it's the two bands of the muscle that are you see the division in the middle hanging there. That muscle divides the superficial compartment from the deep compartment. The superficial compartment is usually only one thing in there, is fat. And so that's what Thermage, Ulthera, and Kybella and all of these therapies are used to treat. The problem with that is twofold. One is that that's not where the fat resides. Even in the fattest patients, there isn't much fat. There is fat there, don't get me wrong, but that's not where the fat resides. The fullness of the neck sits mainly in the deep compartment, in the with the submandibular glands, digastric muscles, as well as the deep fat. Those are the components that need to be treated, not the superficial ones. If you do Kybella, if you do Thermage, all these things, the problems with it, number one, is that you probably won't get a big difference. Number two is you're going to create scar tissue in this, making my surgery much more difficult to work on. You've taken that beautiful subcutaneous fat away from me, which I need to protect over my zone. I still can do your surgery, but it's not a great option to do that. And here's the problem, is even if you're only 30 years old and you've done some Kybella or you've done some Thermage, you go, well, it gave me a little result, doc. What are you talking about? I got, 20%, I got a little better, there was no complication. Why are you making such a big fuss of this? The problem is, one is the result is not that great. They're just minimal improvement, and some people don't get any improvement. But the other problem is it predisposes you to premature aging. Why is that? If you think about it, the banding that shows up in the midline, that occurs with aging. It occurs because of two reasons. It occurs because gravity effects, we all know that, I don't have to explain that to you. The second reason is that that envelope outside starts to disintegrate. As we get older, that subcutaneous tissue starts to go away and then the bands show up. So what do you think you're doing when you're doing Kybella, Thermage, and all these things in that subcutaneous plane? You're trying to do liposuction early at 30, or you're trying to do Kybella, you're trying to take out that precious fat away. Now, it's something I used to do. So it's not like if you look at my old videos, I talk about, oh yeah, a little liposuction works, but I will tell you I've matured over 20 years in practice and realized this is not an ideal solution, because what you're going to do is you're going to condemn that patient to premature aging, where that person that may not have had bands show up until their 60s may now have it in their 40s or 50s, because you've taken that precious fat away and you still haven't given them a great result. So the solution, I encourage you to watch that video on the deep neck lift, because I'm not going to go into it in detail in this at all, but that solution is in the deep neck compartment. And the trick, though, is not just taking out that central compartment of fat, because you do that, you're going to get a cobra deformity where there's going to be a buckling in of the midsection. You've got to do a uniform reduction across the entire area, taking some of the submandibular glands down, not necessarily adding the facelift. Again, that's in that video where I talk about the deep neck lift, which I'm not going to go into in detail here. But this is why it's a little bit disappointing. I know this. When patients come in, they want some fillers and they want Botox, and they absolutely do not want a surgery. And they're telling me, can I do something small, just something to buy me some time? And then it's disappointing when I tell them, no, there's nothing to do for you. I should not and will not do some Kybella in the neck. Now, I'll do some Kybella in the jowls. I don't think it's as far from ideal compared to a lift. That's safe, in my opinion, in the right patient. But in the neck, I'm not going to do Kybella for you. I'm not going to do Thermage. I'm not going to do all these things. Is not going to help you, and it's going to potentially set you up for more problems sooner than later. So I really want you to understand this. Now, if someone's got some early banding, that's a second scenario where, yeah, Botox in this area can bring it back with repeated treatments. I love doing that for early neck banding or for dynamic neck banding. It's a way for someone that says, look, I'm not ready for a facelift. I've got a little bit of early banding. When that's early, I hit them hard every 3 months with a little Botox in the banding. That's not to be confused with meso-Botox. I shot a 25-minute video describing how I work on skin quality down here. I'm not talking about that. Early neck banding, Botox is great as preventative, and it's safe. There's no risk to it, except it's not going to deliver an awesome result. It's a great way to limit that progression of the banding. But if you've got advanced neck banding, Botox is not going to do very much. It's a little too late in the game for that. The way that Botox works is it prevents, and you can listen to, I've done a video on this, is it limits the depressor muscle so that you've got the other muscle to pull up on it. But there really isn't a lot in terms of bulk reduction of the neck that's safe, short of a deep neck lift in terms of improvement of that area. So I wanted to explain that to you, especially if you don't live in Dallas, you're somewhere else trying to get sold a Kybella in the neck or something. It's not good. It's not a good option for you. So I would rather you just do absolutely nothing. And unfortunately, weight loss doesn't always address this. There's going to be always a little bit of subplatissimal deep neck fat. And don't have a doctor that's not skilled to do submandibular gland reductions to convince you, oh, I'll just take a little of that deep fat down, because it's going to lead to a worse problem.